Welcome to AI TV News. In today's Explainer, we're examining a significant policy shift from the Trump administration. On June 3, 2025, the administration rescinded Biden-era guidance concerning emergency abortions in hospitals. This decision has ignited considerable debate, and we're here to break down its implications.
To understand this, we first need to discuss the Emergency Medical Treatment and Labor Act, or EMTALA. Enacted in 1986, EMTALA mandates that hospitals receiving Medicare funds, which includes most hospitals, provide a medical screening to anyone seeking emergency care. If an emergency medical condition is identified, the hospital must provide stabilizing treatment or transfer the patient if it lacks the capacity to provide necessary care. An emergency medical condition is one where a person's health is in serious jeopardy without immediate medical attention. Stabilizing treatment aims to ensure the patient's condition is unlikely to materially worsen during transfer or upon discharge.
Following the Supreme Court's decision to overturn Roe v. Wade, the Biden administration, through the Department of Health and Human Services, HHS, issued guidance in July 2022. This guidance wasn't a new law, but an official interpretation of EMTALA. It clarified that if a doctor believed an abortion was necessary to stabilize a patient during a medical emergency, hospitals were obligated to perform it, even if state laws restricted abortion. The intent was to affirm that federal law, specifically EMTALA, would supersede conflicting state laws in such life-threatening situations. Now, in June 2025, the Trump administration's HHS has officially withdrawn that guidance. The primary justification is that the previous guidance overstepped EMTALA's actual requirements. The current Secretary of Health and Human Services, Dr. John Doe, stated this action aims to, quote, return clarity to hospitals and respect state laws while ensuring true medical emergencies are treated. The administration contends that EMTALA does not explicitly mandate hospitals to perform abortions. What does this policy reversal mean? For patients, particularly pregnant individuals in states with stringent abortion laws, it could heighten confusion and anxiety when seeking emergency care. There are concerns that some may experience delays or be denied an emergency abortion even when their life or health is at risk. For doctors and hospitals in these states, the legal environment becomes more complex. They may find themselves caught between their medical judgment to save a patient and state laws banning abortion. This could create uncertainty about potential state legal action for performing an abortion, or conversely, issues for not providing stabilizing care under EMTALA, although the federal interpretation that abortion is included as stabilizing care is now retracted. Legally, this rescission is expected to trigger new court challenges. The fundamental question of what constitutes stabilizing treatment under EMTALA when an abortion might be necessary remains a highly contested issue, especially since the Dobbs decision. Reactions to this decision are predictably divided. Medical organizations, such as the American College of Obstetricians and Gynecologists, have voiced strong criticism. They express concern that this change will endanger the health and lives of pregnant patients and assert that it politicizes emergency medical care. Conversely, anti-abortion groups have lauded the Trump administration's move. They argue the Biden guidance improperly compelled hospitals to perform abortions and undermined state laws intended to protect unborn life. They maintain that compassionate care can be provided without resorting to abortion. Looking forward, further legal battles are anticipated to clarify hospitals' obligations under EMTALA in states with abortion bans. Hospitals and physicians in these regions will need to navigate a complex legal terrain. The Department of Health and Human Services, under the Trump administration, will also need to articulate its strategy for enforcing EMTALA's patient protection provisions moving forward.
In essence, the withdrawal of this federal guidance reshapes the landscape for emergency abortion care. It places greater emphasis on state laws and potentially introduces more uncertainty for both patients and providers in critical medical situations. Thanks for joining us on AITV News.